Upon insertion of Snap-on Smile, you may find that adjustments need to be made using the Snap-on Smile Burr Kit in order to get the perfect fit for the patient. These could be adjustments to the lingual aspect, occlusal adjustments, adjustments to relieve pressure, adjustments to create a flatter facial aspect, or deepening the embrasures of the appliance.
The most common adjustment necessary that I find with the Snap-on Smile upon insertion would be the lingual aspect of the appliance. For that, I like to use the gross reduction carbide burr. It's a very smooth cutting carbide burr that enables us to not only thin out the lingual aspect of the appliance where necessary, which will enable the tongue to feel freer and therefore create proper phonetics when the patient speaks with the appliance in, but it also allows us to do that by creating a cingulum effect while thinning out in this direction. It's going to create that cingulum effect that we place into the appliances, which mirror images the natural anatomy of the tooth. What this also can do is, in an occlusal aspect or occlusal discrepancy, it enables the doctor to thin out the occlusal spine, therefore creating a more comfortable or almost proper intercuspation that would be necessary for the patient to feel comfortable. Either the occlusal spine or the buccal or lingual cusps, this appliance is wonderful at thinning out those aspects. The next adjustment that I find is very common would be the aspect of the internal pressure that is placed from a case with diastemas. Diastema is the space between anterior or posterior teeth. When we have an appliance that is placed inside the mouth, these spaces can have what we call internal spines, fill in the areas by the appliance. They create a more mesiodistal pressure in an angle or a direction that is not common and not comfortable for the tooth or the periodontal ligament. What I like to use is the tapered carbide burr from our Snap-on Smile Burr Kit. And that tapered burr enables the doctor to go into the internal aspect of the appliance and literally thin out those diastema or those internal spines. By doing so, very slightly back and forth, it creates a little more space from the appliance to the tooth, creating less mesiodistal pressure, and therefore the PDL relaxes, and therefore it is a more comfortable appliance upon insertion. A great additive to this burr would be when we have some pressure from the cemento-enamel junction. That pressure is based on either the retentive areas or the areas that are resting on the dentition. And that can cause a little irritation, especially in cases where there's some recession. And by just rubbing it right along the CEJ area of the appliance, we can create a relief or more comfort in that area. I like to just mention that I do not like to adjust the CEJ right away, or maybe even on the first insertion visit. And what I mean by that is, a lot of times the appliance, being that it's in resin makeup, will settle on the dentition, and that pressure will dissipate, and you will never have to make that adjustment. So before we make the CEJ adjustment, I like the patient to wear the appliance a little bit. The next more common of the adjustments would be the facial aspect. Some doctors feel that maybe at the direct facial or the emergence profile. And as we all know, the emergence profile is where the appliance comes from the gum line. And there, the doctor may want to thin it or even feather it into the gingiva to create more of an anatomical or a more natural look. We at Snap-on Smile will definitely try to give that appearance when we deliver the case, when you get the case, but we all find times with the need to feather in the gingival margin or even thin out the facial aspect. What I like to use there is the medium acrylic polishing burr. The medium acrylic polishing burr enables us from, in a certain angle when it's used, to create a more flattened facial aspect by using the side of the burr. and therefore will create that nice flat facial, and by doing that at the same time create more of a distinct mesial and distal line angles by just simply flattening the direct facial. And if we want to feather, by using the top portion of the burr, we could literally feather the gingival margin in to create a better emergence profile. And that's very simply done without removing a lot of the material and weakening the appliance at all. The next aspect would be polishing. After we use the medium acrylic polishing burr, we need to go over and smooth out the areas that the medium acrylic polishing burr worked on. And that would be the fine acrylic polishing burr. This burr smooths out any rough edges on a very soft, beautiful material as the acetyl resin. And this just creates a very smooth and polished surface by just using the same aspects as we used on the medium acrylic burr. The side of the burr for the direct facial, the tip of the burr for the gingival margin or the emergence profile where we want to get it looking like it came right from the gum line. So we would just burnish it just like that with the fine acrylic polishing burr, and also rub along the areas where we burnished to create even a smoother effect, whether it be the occlusal aspects, the occlusal spine, or even the cingulums. Many times a doctor would like to possibly deepen the embrasures to give the teeth even more definition, or perhaps they want to create deeper line angles. That would be done by the rubber embrasure disc, which would create very nice embrasures on the resin without going very deep. And by doing that, the simple movement of this would be, and as you can see I'm teasing it off the model, the only movement would be very simply, at a 45-degree angle, I like to go right into the embrasure. Now, there are times that I might measure the embrasure using a Bowley gauge, but I know here I'm touching it just ever so slightly, 45-degree angle, and by doing so, I'm doing two things. One, I'm deepening the embrasure, but I'm also creating a stronger mesial line angle on tooth number 9, and then obviously I will flip it over and do it again to create that same effect, deepening the embrasure, yet creating another strong line angle on tooth number 8. And by doing that, I've not only created a better, or perhaps a nicer embrasure to the liking of the doctor and the patient, but I've also created some nice line angles, which will create better aesthetics, if we so desire. Another nice thing about the rubber disc is also the incisal embrasures. What's nice about the incisal embrasures is that if a patient receives a case that's square and would like it rounded, or wants it more square, this disc can create that by simply, again, at the different angles that we will hold it, it could simply roll the incisal angles to the direction we want it, whether we want a more rounded edge, or if we want a more square edge, we'd come onto the direct flat surface of the burr and square the incisal edge of the tooth, creating a very square angle. So we could do both the roundness and the square with this burr, creating the look and the feel that the patient so desires. Lastly is the ability to create that really fine polish so the tongue feels comfortable and the appliance looks fantastic. And that's created by the brown-haired disc, or brown-haired polishing disc. A very unique disc with this appliance because even alone creates a very nice polish, but used with Aqualuster or diamond polishing paste gives it even a higher gloss. And what I like to do with this is simply rub it and repeat its motion over every aspect that I've adjusted, whether it be the occlusal aspect and the anatomy in areas where we have closed holes or we're raising the vertical dimension, or even in the areas where we burnish the appliance to the enamel. I like to rub the disc right over those areas, creating a really nice smooth transition. Like I said before, seamless to the tongue, so it's more comfortable. I also want to do it on the cingulum area and the lingual aspect of all the teeth, and of course the facial. Wherever we touched, I like to polish and give it that really beautiful look. And those are the most common adjustments needed when you're inserting the Snap-on Smile appliance.